Tracker coverage continues this morning. The FTC, FDA, and CDC are putting a pause on the use of Johnson & Johnson vaccines in the U.S. Across the country, the CDC says about 190 million vaccine doses have been administered. Only about 7 million are those from Johnson & Johnson. Julia Palazzo is live this morning with more on what went into that decision.
Yeah, we spoke with the Metro Public Health Department and the city's leader of the coronavirus task force, Dr. Alex Jahangir. So Metro Public Health just opened this drive-through vaccination clinic using the Johnson & Johnson vaccine yesterday. And now they are transitioning into making sure that that vaccine is not being used and that they're using the Pfizer vaccine, so that anyone that has an appointment, it will not be rescheduled. You will just be receiving the Pfizer dose instead. So he says that their Pfizer supply has been extremely stable, so there are enough doses to fill those spots. He knows many people, especially those who received the shot at last month's mass vaccination event, might be worried with this news, but these are only 6 blood clot cases out of 7 million doses, and it's affecting a specific subgroup of individuals. That is women ages 18 to 48 who received their shot over the last 2 weeks. Anyone who attended Nashville's event likely won't have issues moving forward. But for the 200 people who were vaccinated here yesterday, make sure that you're closely monitoring how you feel over the next few days. Johnson & Johnson is a different platform than both the Pfizer and Moderna vaccines. It's still just as important as ever to continue vaccinating as many people as possible. Recent studies have shown the risk of getting complications from COVID are extremely high, and the best way to end the pandemic is to get the vaccine.
Will people have the confidence in the Johnson & Johnson vaccine? And I think time will tell. And again, I'm reserving any judgment until the people who really know this stuff and evaluate the data and make an opinion. But if something's not safe, and that's what the science shows, then I don't think we should move forward. If it's safe, though, I think we need to work on regaining the trust of people if that's the vaccine that we use.
Metro did plan to use Johnson & Johnson vaccines to help vaccinate the homeless, but they are now converting those plans, just like this vaccination site, to using the Pfizer vaccine. So we'll make sure that we stay on top of this story for you throughout the day and bring you the latest here on air and on WKRN.com. Reporting live in South Nashville, Julia Palazzo, News 2.